Wait, so did you always want to be a psychiatrist, or was it more like in med school you were like, were you entertaining any other specialties, or was it always psychiatry for you?
Yeah, so honestly, like when I had always known I wanted medicine in general, kind of like
Mm-hmm.
from a young age. I was just telling someone like the reason I wanted medicine was because I just thought doctors' jobs were cool. And every time I go to the doctor's office, I was actually very excited. So I just wanted to be able to do that one day.
Mm-hmm.
But I think the psychiatry kind of decision came later on. And just from like, I mean, full disclosure, like my own mental health struggles with things like anxiety and depression at times. And I feel like at a certain point, I felt like that is, I mean, it's such a hard place to be in, to live that way. And I wanted
Yeah.
to be able to help people in some capacity. And I think everyone, no matter their field in medicine or whatever their profession is, they have probably reasons for pursuing what they want to pursue and some
Mm-hmm.
kind of like place where their heart is in that. And for me, it's always been psychiatry. Like I could never care that much about losartan, like it's not that interesting to me.
I love
But
how losartan was your first thought. Okay.
but yeah, I think I always resonated with like connecting with people and just
Mm.
behind all the things that we have, our professions and everything. Like at the end of the day, we're all human beings. And I think
Mm-hmm.
that's really special. And we all just want to enjoy living in this world. So that really struck me.
What is something where now this is your first podcast, I know, so like that's such an honor to me. I'm kind of curious, like, what is the one message that you really want our listeners today to like walk away from? If they had to share like with their friend, like, oh my gosh, I just listened to this episode with Dr. Tina, who's a psychiatrist. What is that one message that you want them to leave and share with the world and to know?
Yeah. I mean, obviously, being a psychiatrist, I can't help but state like, if someone is going through something, there's no shame in getting help. And I think something else I try to highlight a little bit, or I hope that I can throughout life, is the fact that there are people who are successful, who are living, working, breathing humans, who have families and great careers and are thriving in life, who have had mental health struggles in the past.
Mm,
I think when we can talk about it a little more openly,
mm.
it's helpful, and it kind of like, it becomes less of the scary thing to talk about. So I hope that people can realize, hey, no matter what you've been through, you can have a very successful life. You get to choose what you do with your life from this point forwards. And your job is not your only part of your life. That's the other thing that I want people
Mm.
to know.
That is such a
Yeah.
good one.
Mhm.
When you say shame, it makes me kind of think like, I'm just curious, what was your relationship with shame like when you were going through, you mentioned you've also gone through like anxiety and depression. How did shame play a factor, and how did you experience shame when you were going through like your darkest times?
Yeah, that's a great question. I think for me, like the anxiety piece has always been the bigger one.
Okay.
And I think especially in like medical training, for me,
Mm.
I wasn't formally diagnosed with any type of like social anxiety, but I feel like I self-identify with that a lot in terms of just fear of perception from others and a lot of like rejection sensitivity vibes where if there was any type of criticism on me, I would take it very personally and I would just like really just beat myself down of like, okay, I'm not cut out for this. I can't do this. So I think especially being in medical training and experiencing that was an added layer that I feel like many people didn't have to deal with. And for me, it was residency too. I remember like distinctly there were times where the amount of times I cried in front of attendings in residency,
It's
just because I was
relatable.
like, I'm not doing it right. I'm not perfect. And they were like, you're literally still learning. You're fine. You're doing great. But I never wanted to listen to them because I just felt really like anxious about my performance in front of people or anxious about these interactions that I was having with people. So I know like, there's such a spectrum of mental health conditions, obviously, some certainly more fatal than others. I think each one of them are extremely valid. And no matter what it is, right? Like there is a way through it. And I just want people to know it does absolutely get better.
I'm kind of curious from your perspective, like, because you just spoke about anxiety and depression like so eloquently. I think also a lot of people like mainstream media, we have this perception of what anxiety is. We have this perception of what like depression is. What's like a nuance that you've personally seen as a psychiatrist? What's a nuance to anxiety that like most people don't realize or don't even see?
Yeah. I think in this day and age too, especially as like the conversation of ADHD comes up more and more, um, I'm I'm gonna stay focused on anxiety, but a lot of times people think that they may have symptoms of like trouble focusing, not being able to pay attention, just mind in a million different places, and our minds go to ADHD. But a lot of anxiety presents that way too. And it was actually funny because in residency, I did like this neuropsych evaluation because I was like, I can't remember anything in residency. I'm not studying well enough, blah, blah, blah. And
Uh-huh.
I literally went through a whole neuropsychological recommendation because I thought it could be ADHD even. And he told me, no, it's probably anxiety. Because what happens when you're anxious, right? Like your body is in this state of fight or flight activation
Mhm.
and essentially just trying to survive. And your cognitive precision is not going to be what it would be like if you were calm and composed and experiencing just a calm level of just like alertness. So that's something I didn't know, just like the impact that anxiety can have on thinking and cognition, especially for high achievers or people who are in grad school and working people. That could be a reason that that shows up in life. And then I think the underrated one for depression too is that it's not all just like sitting in your room and crying all day. It might also just look like, hey, I haven't talked to my friends in 3 weeks and I don't care. Like I haven't thought about it and I'm self-isolating. So there's definitely a lot of nuance and it's not as like dramatic as some people might think. But I do think if you're noticing some of those signs or you just find that you're not the person that you used to be, it is worth talking to someone about and figuring out, is there something different going on that could very easily be helped? Absolutely.
Can you touch on like something I experience and something I know like a lot of people experience out there? Part of it's probably just because like being a busy healthcare worker, it's like so easy to be overstimulated when you come home. But I noticed too, like a lot of times, like I'll think about texting a friend, but then the thought of picking up the phone and texting them and talking about something, I'm like, oh, that like seems a lot. Like, let me just like save that for later. Or let me respond to that person's text later when I'm in a better headspace. And then I forget and it like sucks because then I've left my friend on red. Like
Mhm.
what's going on there where like I think a lot of people in this age, even reaching out with technology feels like a lot.
Yeah, yeah, that's such a great question. I think it's probably a combination of things. Like, one, I think it's kind of maybe the expectation we have about that interaction of
Mhm.
if I text my friend, well, then they're going to text back and then I'm going to have to think of like the next thing that I want to say to
Mm.
them. Or I think some people also have trouble like being that first initiator. I know I do
Mm.
sometimes where, like we're scared of potentially being rejected. Ideally, if you're talking to your friend, you're not going to be rejected necessarily, but I
Mhm.
think that also puts pause for people to be the first person to initiate something or be the one to propose that you guys hang out. And sometimes it is, I think, truly like, especially as a working professional, sometimes it is a matter of energy. I
Mm.
know I've definitely had days where like I literally the only thing I want to do is bed rot or watch
Yeah.
like Love Island at the end of the day and my brain can't handle anything else. So I think that's a factor of it. It's something that I'm still trying to figure out the balance with too. Especially, I genuinely do love my job. Like I'm grateful to be able to say that. But I think also in order to be good at my job, I need to build like a life outside of that too and take care of myself. So I I think all of us could do that. But yeah, I think that those are some of the reasons why that might come up.
Do you think at all too, like it's interesting because as I hear about your work and like what you observe as a psychiatrist, I also like never really realized how you are so ingrained in like people's daily habits. Like you learn so much about like just how people function. I'm kind of curious from your perspective, like what are some things that we might not realize we're really doing nowadays to like self-sabotage? Like even for that example of me being like, oh, I don't reach out as often as I could. But like what are other sneaky things where like a lot of your patients don't realize they're self-sabotaging?
Self-sabotaging. Yeah. I think the biggest one that comes to mind for me is kind of like telling yourself the answer will be no before you've even asked. Yeah, I even today, like in my own personal life, and with patients alike, I find that it's really easy to get in a cycle of like, oh, well, I'm not going to bother trying this new thing because it's not going to work out. It's fine. And we have this tendency to predict the future before we know what's going to happen. And I've been trying to reframe that a little bit of, the worst that could happen is no, and a no is not bad. It's just an answer. It means nothing about your worth or whether this is an option in the future or not. But I feel like people do really shut themselves out of opportunities by telling themselves it's the answer will probably be a no, so I'm just never gonna try. I find that like I'm really inspired, honestly, by my friends who like we're the crazy friend group that has like the most silly dreams, I feel like. And that I think is really nice because as adults, we kind of somewhere along the way forget that we can still dream and we can still try new hobbies and try like a new career choice or go back to school. So I think that's a huge one that can hold us back in adulthood, especially when life gets more complicated.
Was there ever like a time, because like now in some regards you're living like past Tina's dream, you're like the attending now, you're living the great life. Was there ever a time though where like you thought that dream was like never gonna happen, or like was there ever rejection you had where you were like, that's it, like that's the end of the road for me?
Oh yeah. That I wish I had a status, like a board of how many times I truly believe that in my head because I'm convinced it'd be in the thousands.
Oh my gosh, yeah, what's like
It was
the
so
most like
bad.
heartbreak you've had from this journey so
Oh my
far?
gosh, truly, like, and I'm not even joking when I say this. I vividly remember the first week of medical school. I was
Oh.
extremely overwhelmed. And like,
Mhm.
going into med school or dental school or pharmacy school, like it's a fire hose analogy. They are going to throw a lot of information at you and expect you to remember it. And you have an exam in like 2 weeks and you're stressed and you're overwhelmed. So that was my first week of medical school. And I truly like just sat in my room and cried. And I thought, I don't know if I'm cut out for medicine. And that was really hard. At that point, I did like have a sense that I wanted to do something in mental health. So I literally was like being very anxious and Googling my school's program because they also had a psychology program. And I was like, if not medical school, then I can pivot my entire career and do something else. But there were so many moments where I really catastrophized in my mind before I even gave myself a chance to fail, maybe. And yeah, I would say that that's happened a lot along the way.
What do you think helped you in those times where you were like, I just like I don't know if I can do this?
Yeah, yeah. What helped me in those times was definitely my family support. I will say that. Like
Mm,
I have
you're close to your family.
yeah, I would say so. I definitely like will let them in, let them know if I'm having a difficult time.
Mm,
And I do visit them a lot. It's nice. I feel like my parents have really been good supports throughout this and truly like I wouldn't be sitting here today if it weren't for them.
mm,
In addition to that, I think obviously my own doing got me here too, so I'll give
mm,
myself credit for that. For me, there's always a thought in the back of my mind of like, if I don't try this, then I will literally live
mm.
the rest of my life wondering what I could have done. And
Yeah.
I remember vividly thinking that too about psychiatry of like, I don't know if I could give this dream up. I'd probably always wonder.
You mentioned like your parents playing a role in all of this too. Like, is there anything where you catch yourself saying or thinking now that you're like, oh, that's totally from my mom or my dad, like
Yeah.
from their upbringing?
Oh yeah. Is this related to anything in life or what are we talking about?
Just related to anything, like
Okay.
any of your either the way, like for better or for worse. Like I think
Yeah.
so much of how our parents raise us gets imprinted on us.
Mhm. Mhm. Yeah. I think what I'm noticing now is a lot of like the financial ethic of my parents. Like
Oh
they
yeah.
that's kind of adjacent, I guess, but like I was really lucky to have college paid for by them. I
Mhm.
took out loans for med school, but like they were really conservative with money growing up. And I think that is something that I am really cognizant of in uh, now my adult life, like managing my own money. And it is interesting too when you're in a relationship and you have one style of kind of saving, hoarding all of your money and like
Oh,
protecting
so
it at all
true.
costs. And then your partner, like is a little more flexible with it. So I think maybe my tendency to want to save for a bad day,
Mhm.
it definitely comes from them. But I think also in a positive way, like I don't know. I think generally I would like to think I'm a humble person, but
Mhm.
I do think that my parents have always kind of ingrained that in us and like told us no matter what happens, like do not brag about yourself, do not like show off all of the things that you have, be grateful. So I do think about that a lot. And yeah, I'm thankful that they've instilled that in me.
This is like so relatable as like
Yeah.
a child of immigrant kind of experience, because like I also think like so much of like even doing social media is like such a foreign hard thing, because like I've been programmed to like, yeah, not show off, not brag, make yourself kind of like just be humble about like your
Yeah.
experience. I'm kind of curious too. I know we've talked about this before, but like I want to know like what kind of lifestyle creep things you've been enjoying since being an attending, but
Mhm.
also B, did you have like a big girl purchase like once you started like being an attending?
Oh, yeah. Yes, I did. I do allow myself some luxuries.
What do you do?
Yeah, yeah. So, I mean, my husband and I love going on vacation. So we've been doing a lot of
Nice.
that, which is great. We're going to Mexico in a couple weeks and then we're going to Vegas. So definitely we
Oh,
splurge
nice.
on trips, luxury purchases. So I'm like just dipping my toes into that now.
Okay, what do we
But
like?
yeah, so I recently got like at this last psychiatric conference I went to in LA. It was at the APA last year. My
Mhm.
husband and I went to Louis Vuitton. I was like, I'm gonna
Oh,
get my
nice.
attending purse. Like this is gonna be my first
Ah!
purse. So that was my first like luxury purchase for myself.
Uh-huh.
And now we're kind of like thinking more about a car and actually like having
Mhm.
a nice like functional car that we can keep for a while, test driving some different things. We'll decide, but yeah,
Wait, I have
certainly.
to ask, for the Louis
Yeah.
Vuitton bag, did a part of you like I like nice things now, but also I still get sometimes like a cold sweat being like, "Wait, what did I make a mistake?"
Yeah. Still, I feel like that still happens and I'm like, wait, was it actually worth this purchase or not?
Yes.
I think I'm getting a little bit better at that, but yeah, I used to be someone who like would feel very guilty for spending money on very small things.
Mhm.
And I realized over time, right, like generally if you are being wise with your money on the whole, like the few dollars that you spend or don't spend here or
Mm.
there don't make as big of that difference.
Mhm.
I'm allowing myself leeway with that. And I will say I do like have an impulsive purchase every once in a while. Like I'll go to Saks Fifth Avenue and get myself some YSL lip gloss and
Oh, I love
do that
that.
whole thing. So yeah, I am trying to invest in that more intentionally, just like not even on the money side of things, but just
Mm.
consumption wise. I don't want to accrue items that I don't actually need. And if I
Mhm.
have them, then I want them to be like good quality. So that is something
Right.
that I have a goal of. I love fashion. I love makeup. So I'm excited to indulge in my wardrobe more
Mm.
as an attending. That's super exciting for me.
Speaking about like fashion and makeup and all of that, like I'm curious who were some of those like mentors in your journey? Like I think about like I used to look up to people like us when I was on my journey. Be like, "Oh my god, the attending with the cool like makeup and the whatever." Who was like tell me about a mentor that was like so pivotal in your journey?
Yeah. I don't know if this counts as a mentor because she's related to me, but
That's totally okay. Yeah.
no, I have a cousin. Her name's Melissa. I feel like she is this role model for everyone in our family. She was one of our oldest, like female cousins, and she was one of the first doctors in the family that I remember, and she's like just a gorgeous person on the outside and inside, and
Aw.
she's a physician. And I think that made it very easy to like really want to be her. And I'm glad that she had that impact because she is genuinely like a very, very kind person and a humble person.
Mm,
And I feel like I saw like what she was doing. I wanted that. I wanted to make a difference for people and also like live a beautiful looking life.
mhm.
So I think she shaped me in that way. Certainly on like rotations, I feel like I've had attendings and female mentors. Like I used to scribe in an ED before med school.
Oh.
Yeah. But there were a lot of female attendings who were just very real and told you about the pros and some of the cons of medicine as a woman. But I feel like that was more resonant for me, even just to be able to see like a female person of color in medicine
Yeah.
who's doing well and is making it work and is enjoying their career choice. So those are maybe a few of the mentors that I've had.
Yeah. Oh, that's so beautiful. What were some of those like, I mean, you mentioned like the pros and cons
Yeah.
of like practicing. What are some of those like cons that we might not realize? Like I feel like a lot of people, especially as a psychiatrist, like a lot
Mhm.
of people know like, oh, it's hard. It's a lot of like people, it's like hard work, the hours, especially the hours for training too. But
Mhm.
like what might be a con in your like day-to-day practice now that people don't realize?
Yeah. In my day-to-day practice now, I think the biggest con probably is the emotional investment and at times if like unfettered exhaustion. And I think like again, this is a generalization, but I do
Mm-hmm.
tend to think that people who are quite introspective go into psychiatry and like
Mm.
want to know a lot about the human mind, and it's really easy to get sucked into that and like kind of do more than what your role actually is. I know I'm guilty of
Oh,
that. And for that reason too, I think that also is not necessarily helpful for myself or for patients to be
mm-hmm.
very emotionally invested and kind of take on the role of not only like the person prescribing the medications but also the therapist and like let me help you figure out a good resource for finding a house. Like it's very easy to
Oh,
be too
yes.
empathetic and lean into that too much. So I think just setting boundaries more has been something that I'm still learning, absolutely. But
Mm.
I would say if you tend to very easily just be an empathetic person and have guilt for not doing everything you possibly can to help someone, that can be hard.
Yes. That literally happened to me, like, yesterday. I was just talking to a patient. I'm still, like, trying to figure this out. I was just talking to a patient who told me, like, oh, they're so nervous they're about to see their specialist, like, in a month to have their wisdom teeth taken out. And I was like without them asking, I was just like, oh my God, like you're nervous? Let me call you the week of your surgery and I'll like reassure you. And they're like, oh, that'd be so great. And then after I was like, great, now I need to put on my calendar to call this random person. Like I volunteered myself for this. I
Mhm.
didn't have to do that.
Mhm, mhm. Yeah, I find myself doing that all the time. Like, and still, these are things that I'm slowly trying to unlearn. But
Yeah.
I find myself doing that too. I'll like promise to deliver on something that there's zero expectation from even the patient for
Yes.
me to do that, right? So it's a kind thing. The intent is great, but I think at the end of the day, it's not sustainable for
Right.
yourself. And I mean, when you're thinking about all the patients that you get to treat in your lifetime, you
Mm-hmm.
want to give them the best care that you can that you're qualified for. But also, I don't think that's the only way to show empathy and kindness. And that ends up showing through anyway when you're doing exactly your job description.
Wow, that's such a good mic drop. That's not the only way to show empathy and kindness. Like I feel like all of us overachievers are like, how will they know I'm empathetic and kind? And it's like,
Yeah,
I don't know, if you spend like 5 minutes talking to us, you could probably get it from
literally.
us. Like you don't have to bend over backwards to show that you are all the things that you already are.
Yeah. Yeah. I absolutely resonate with that. And I think as overachievers and type A people, sometimes it's hard to really internalize that and believe that that's
Yeah.
true about yourself.
Do you have like a boundary that you have successfully set for yourself? Like what's something that you're kind of proud of that you
Yeah.
maybe you right out of the gate would have done, but like now you're a little bit more firm on?
Yeah, absolutely. I think truly like even as recently as this week, I have been really good at setting boundaries in terms of what we're going to talk about related to medications and what we're going
Yeah.
to talk about in therapy because that it truly was something that was bleeding over too much and I had patients literally tell me, "I know you're my psychiatrist, but like you're basically a therapist to me," which in the moment was very kind. I was like, "Oh, I'm
Yeah.
doing so much good in the world. This is great." Later it yeah, it did wear me down. It would leave me feeling
Yeah.
really drained at the end of the day. And then I would feel like, well, now I just almost at times dread seeing people, and that's not how it should be.
Mm,
So recently, yeah, I have been kind of really being cognizant and paying attention to the medication management side of things,
mhm,
and also being warm and empathetic and learning about people's lives. But when they do kind of dive a little deeper into what could be done in therapy, I'll say, hey, totally hear what you're saying. I think this is something that we do want you to address in therapy. So I'm
mhm,
trying to just be a little more intentional about setting the boundary between what we can do in psychiatry and what we do in therapy.
mm.
So I think I'm doing pretty well on that, not gonna lie.
That's awesome. I'm so proud of you. That
Thank
is, like,
you.
so hard. I'm so proud of you. I hope, like, in a couple years I can, like, get there. It's all the kind of things that experience teaches you, right?
Yeah.
I am kind of curious too. So, like, it's funny in dentistry, there's like multiple types of dentists. You're either like a this kind of dentist, like there's like for example, there's like aesthetic dentists, there's outgoing dentists, there's more shy dentists. There's like kind of like different tropes. I'm curious if psychiatry has the similar tropes. Like, are there certain like stereotypes or
That's
things
so
that you fall into?
interesting. Yeah, that's so interesting. I feel like the biggest stereotype is like psychoanalytic, like old man with glasses kind of
That's kind of what I was
stereotype.
thinking.
Yeah,
Yeah.
exactly. Yeah. Which exists and they're awesome. And I feel like they are, I mean, they're like people that have seen psychiatry change a lot over the
I'm
years.
sure.
So they have so much knowledge and their style of psychiatry it's very valuable. But
Mm-hmm.
I think, yeah, there's that trope. And then there's, I think, a new generation of psychiatrists now who are a little more biological, a little more willing to integrate some therapy and not be as
Mm.
quick to prescribe medicines if they're not needed. So that's a trope. But what else is there? I'm trying to think.
Oh, I'm also curious about this. Okay, how would you spot a psychiatry resident or student in like the med school library?
Ooh. Oh, okay. How would you spot a psychiatry resident or med school student? I feel like you'd spot them. I can only think of the stereotype of them sitting on like the futon or the chaise lounge. They are probably honestly giving everyone a pep talk and being like, "Bro,
Oh,
we're
that's
gonna
so
pass this
cute.
test. We got this. Don't worry about
Yeah,
it." Yeah,
they're
they're
like
the
giving the anesthesiology residents like a pep talk.
yeah. Yeah. They're like, I know you're gunning for a different
Yeah,
specialty, but
it's
no,
so
in
funny.
actuality, the people that I went to med school with who ended up going
Hmm.
into psychiatry, they were those people that people could just trust with their emotions. And like when times were
Oh,
stressful, they were the ones to bring the temperature down a little bit. So I find
yeah.
that those are usually, yeah, the people that are just good at psychiatry and just kind of like, things will be fine. We're going to move through.
I'm so curious if there was a pipeline from being a John Green fan and like the Fault in Our Stars fan to working in psychiatry or like mental health. Tina and I actually just discovered about each other that we probably would have been best friends during high school because we were both like massive John Green like Tumblr girlies. So I'm gonna beg Tina to like unpack and like find her Tumblr, dust it off, and like show us some of her posts at some point.
Absolutely. Yeah, I have to like figure out what my password is, but as
Yeah.
soon as that happens, we're gonna rejoin and collab and review them.
Wait, also I have to ask, were you at all like I wonder if my whole like artsy Tumblr phase, like no one gets me kind of thing, except
Yeah.
for my internet friends, like I wonder if that was a byproduct of like I grew up in a very predominantly white neighborhood. Was that like your experience in Philly, or were there like a lot of Indian people where you lived?
Yeah, that's a great question. So I grew up like from 7 to 18 in a town that's like an hour north of Philly.
Mm-hmm.
And yes, it was extremely like Caucasian.
Mm-hmm.
There were maybe growing up like three in total Indian girls in my class. So
Yep,
I grew
same
up,
as me.
yeah, there was very little diversity. And it's interesting to look back now because at the time, obviously when you're a kid, at least for me personally, I never thought anything of it. I
Mm-hmm.
kind of like felt othered in the moment, but I never thought of anything of the fact that everyone around me was white. And it
Mm-hmm.
wasn't until I got to Temple where like it was just a huge melting pot of everybody that I realized, oh wow, I grew up in a
Yes.
really white town. Yeah.
Oh my God, I feel like I had such a similar experience because
Really?
it's kind of like you don't know what you don't know. So you're just kind of like, well, this is life. And it's like
Yep.
normal to be different from everyone else. And I also feel like the reason why I asked that is because I feel like when you grow up in that way, you just kind of almost get used to feeling like an other, like what you were saying. And
Yeah.
then once you do, like that was my experience. Once I started dental school, I was like, oh my God, like Asians are the norm in some places. Like, and then also all my friends from California, like my East Asian friends from California, like they have a certain vibe where I knew that they grew up with a bunch of other Asians. Like I don't know what it was, maybe this certain like healthy amount of confidence or something.
Yeah. Maybe that's what it was. Yeah.
Yeah, I'm like confident in not being othered.
Right. Yeah. No, I totally resonate with that. And I think that like informed what I was like at college because you would,
Mm,
especially in the Indian community, I think like there are so many Indians in Philadelphia, which is awesome. And I think
yeah.
like if you grew up kind of integrated in that culture and like did things like dance or like different Indian clubs, which I never did for whatever reason, my parents didn't want me to. I think they just really
Mm.
wanted me to be like as American as possible. So none of my friends were Indian growing up. And then coming to Temple, I feel like I was trying to kind of integrate with
Hmm.
my fellow peeps, and it just never felt right for me. Like I always did
Yeah.
feel a little awkward and uncomfortable. And the Indians that I did end up befriending were also the same Indians that like kind of had that same exact experience of growing up in a community where we're the one of the only ones. So that's
That's
really
kind of exactly
interesting.
how I feel is like all of the Asians I'm friends with, it's not because they're Asian, they just happen to be Asian. But it's
Hmm.
not like I sought out this like Asian friend group because I
Right.
also like never quite fit in with like the like I feel like in dental school there's always like one like tight knit Korean group. I'm not Korean, but like people always think I'm Korean. But like there's always
Yeah.
like one tight knit like Asian or like Korean in particular group. And I
Hmm.
feel like I never like fully like fit in with those groups, but it was more like, oh, like you happen to be Asian. Like we relate on some Asian level,
Yeah, yeah,
if that
absolutely.
makes
And it's
sense.
interesting too, because I noticed like people in those groups will try to like that is your common bond, right? Like they'll identify you and be like, hey, like, do you want to kind of test the waters with this friendship? I've noticed that a lot
Yes.
too. Which yeah, I think then I realized like, okay, we have this in common, but are we similar in other ways in like the way that I actually want a friendship to be? So yeah, that's
Yeah.
something that I think I'm just like figuring out lifelong, honestly. But it's really interesting to think about identity and just how that shapes who you are and who you kind of become and gravitate towards growing up. It's really interesting.
As an attending, like, how has it been for you finding new friendships? Because like so many of my listeners and myself included, like we're a couple years out of school now, and it's like you keep in touch with your friends from school, but it's like, how are you personally like finding these new friends if you have any?
Yeah. Yeah, that is a great question and one that I am still trying to find the answer to. But yeah, I think also like a product of being in your 30s too. And,
Mm-hmm.
like I'm married, I know you're married, and
Mm-hmm.
um I feel like I have a lot of comfort from my husband and like we are each other's best friend. And
Yes.
my tendency to be a little bit more introverted kind of like sometimes can keep me in a bubble. I will say that. But what I've noticed, especially moving to the city that I live in now, there are a lot of transplants in the city and you
Mm-hmm.
can find activities to do. So what I've been trying to do is lean more into activities that I just want to try for my own sake. And then kind of
Ooh.
like, yeah, like I've done improv classes, which has been
Oh my
low
god,
key so
Tina!
fun.
I need to learn about this. Okay, this was actually on my bucket list for like eventually in life. I don't know if it'll happen this year, but like what has I've wanted to try improv classes. What is it
Yes,
like?
do it. Oh my God,
Is it scary?
it's a little scary at first, but then like you become addicted to it, so it's fine. Yeah, I mean like I'm someone who if you meet me in the real world just like out and about, I'm pretty introverted. Like I really don't talk a lot unless I have something to say.
Mm-hmm.
And I feel like I tend to overthink and want to
Mm.
say the perfect thing. So I challenge myself to take an improv class for the reason of just like improvising and having no way to prepare.
Mm.
And just like having kind of testing my speaking skills a little bit with that.
Mm-hmm.
Um, and I also like just grew up watching improv and Whose Line Is It Anyway?
Oh
And
my god,
I mean,
yeah.
it was always so fun. I love to laugh. Like I love comedy shows. I really admire people who can be witty and funny and quick.
Mm-hmm.
So I just thought it'd be a fun thing to take like improv 101 level class and see how that feels. And then I do end up meeting people. I will say like I haven't probably become best friends with anyone in these classes, but it's
Mm-hmm.
nice for me. Like I realize I also see value in a community almost in like a shared space and being with people and
Mm.
not necessarily, having to have someone who is like your number one person that you confide into all the time. So
Right.
I'm kind of like learning how to navigate that and embrace more of that in this city of DC. Um and then I'm also like growing the friendships that I already have and seeing how those evolve over time too.
Mm-hmm.
Because the friends that I do have, I would say like we've been friends for like 20 years, I
Oh
would say.
wow,
Like
that's
I have strong
impressive.
friendships with people and we've seen each other through various phases of life. And it's really interesting because we all change so much over time too. So
Yeah.
yeah, I find that I really want to invest in those friendships and I see, the value in that and seeing what like these friendships can look like now in our 30s compared to when we were in our teens or our 20s.
Right.
So yeah, it's a lot of like just trying my best out here. I think in your 30s it's not as easy, but no, it's been fun to try new things too.
Your 30s is so interesting because I feel like you have so many friends now in different phases of life. Like I have some friends who are married. I have one friend who has a kid, but then I have other friends who are like still dating. It's kind of like we used to all be on the same page and now it's so spread out. And that's what makes like your friends that you're still close with really cool, but then also like it's just an added layer of like complexity, I think, to friendships.
Oh, definitely. Yeah, I think especially in the 30s, like my core friend group that I'm with, like a couple of us are married, one has a baby on the way, and then two of us are still like single and dating. So,
Mm-hmm.
it can be so varied. And yeah, I think like something that I'm trying to explore a little bit more of is like meeting couple friends with my husband.
Mm.
I know that that can be rewarding. For whatever reason, I'm a little weird about it. Like I feel like I'm the problem.
Oh
um,
my god, you're
like I
that's
don't
so
know. It's
funny.
just I feel like how can two people be compatible with two people at the same time? And we're both like individually a little introverted, so it just
Yeah.
takes a little extra effort, I would say. But yeah, even in that vein, we're gonna try doing like pickleball and do a team
Oh,
together. So
cute.
I feel like that'll lend itself to it.
What I wanted to know about you was in a friend group, like which one are you? Meaning like every friend group has like someone who initiates plans, someone who always gives advice, someone who like always flakes. Like in a friend group,
Here.
which one do you think that you are?
Yeah, that's a great one. I think I do tend to be the one who like will rally the troops and say, "Hey, like, why don't we try this thing? Who's around?" As the plan initiator, and it's funny because everyone in my my husband and my sister actually in my life call me the glue to relationships. So I feel like
Oh,
I don't know. For a long time, I struggled with that. I'm like, I'm the glue. I'm all out of all things. I'm the glue. I'm not like the star or like whatever.
yeah.
But I think I've like resonated with that a little bit more because I've noticed that in certain groups, right? Like when
Mm-hmm.
life gets busy, you can easily not see people for quite some time. So
Yeah.
I do tend to be the one that'll kind of reach out to people, coordinate something. I think I'm also probably the person just like being more of a listener rather than a talker in
Mm,
like the real world. I tend to be the one that people come to for vent sessions and
mm-hmm.
letting them, me know about what's going on in their life, which is it's good. I definitely am like working on setting boundaries and not being like in psychiatrist mode and just being in like
Mm,
best friend mode.
mm-hmm.
So that's been good. But I feel like I've already always naturally kind of leaned into that role of like
Mm-hmm.
wanting to calm people down, wanting people to be like come together, bring friendships together. So that's where I've always felt really comfortable in a friend group, I would say.
Oh my God, I love that. Actually, this is a really great segue into the second part of our episode. So I have Tina on for not one, but now two features of the podcast. This was like our little first episode to get to know Dr. Tina, but now we're going to go into the second part, which is Tina's going to help me answer some of your chief complaints, some of your questions, your anonymous cases that you guys need advice for, random work and life things. So definitely check out the next episode for that. Tina, if you could just leave for this first episode where everyone can find you and reach out to you.
Absolutely. Yeah. So my TikTok account is Life of a Doc Girl, DOCGIRLE. And oh my God, GIRL. I can't spell.
You're
Life of a Doc Girl. That's a little more of like my casual TikTok account where I post anything about medicine and psychiatry and just my own impulsive thoughts. And then my you can professionally follow me at Dr. Tina Thomas on Instagram.
awesome. Thank you so much, Tina. Thank you for being so vulnerable and for being so just eye opening for this first episode. And I hope everybody looks out for our second episode coming out next week for part two, where we answer your chief complaints. Thank you.
Thank you so much, Connie. This was a pleasure. Thank you.
Of course.